Now, this surge in COVID cases has resulted in a growing demand for booster doses. Taking to Twitter, entrepreneur and Padma Bhushan awardee Kiran Mazumdar-Shaw urged the centre to allow companies to provide booster doses of the COVID-19 vaccine to all their employees. In her tweet, the executive chairperson of Biocon said companies are facing massive work disruptions as a result of workers testing positive for the virus amidst surging positive cases. Remember, India's booster shot program at the moment is restricted to frontline workers, healthcare workers, individuals above the age of 60 and those with comorbidities. And so far, about 40 lakh people have received their precautionary doses. And joining me now is the Biocon chairperson and founder, Kiran Mazumdar-Shaw, joins me. Appreciate your joining us, Kiran Mazumdar-Shaw. The big question, of course, is you've gone now on Twitter on a public platform and said that booster doses must be available to all employers to give to their employees to avoid the kind of massive work disruptions taking place because of Omicron. Are you saying that you believe that the booster dose should not just be limited to those over the age of 60, those who've got comorbidities, make it universally accessible to all?
Yes, Rajdeep, for the simple reason that we do not have a situation of vaccine inadequacy anymore. I think we have adequate vaccines with which to actually deliver booster doses. Now, as an employer, I know the kind of work disruptions that we are seeing with over 300 people testing positive in a company such as ours, which, as you know, is a manufacturing and R&D driven company. We have to have people, coming to work in situ. And when you find these kind of disruptions, obviously it disrupts, your manufacturing, your R&D, and many other enabling functions. So I, for one, would like to give booster doses to all my employees so that we actually prevent, such surges that we are seeing presently.
You know, the government would turn around and say, look, our focus at the moment is first to double vaccinate India's entire adult population. As of now, Kiran Mazumdar-Shaw, about 70% has been double vaccinated, about 65 crore beneficiaries. So we've got another 30 crore left. So the focus, the government says, is to use existing capacity to target that group before turning to boosters, which in any case, it is uncertain whether they can stop infection and transmissibility of Omicron.
Well, Rajdeep, you have to look at it this way. First and foremost, the balance 30% can easily be vaccinated because we have adequate vaccines with which to carry out the remainder of the vaccination for our population. But on the other hand, what I'm saying is, look, I'm not asking the government to deliver booster doses to everyone, but I do believe that you must open it up to the private sector, to the private market, and, allow people who want to be, boosted to be able to do so. I can tell you there is so much of anxiety amongst people, who are wondering whether they will catch Omicron or not, and they all believe that they would like to be boosted to protect themselves. So I think there is a huge need to basically allay people's fears, and there is a need to cater to employee needs and employer needs so that we can actually safely carry out our activities. I think there is already a deep impact on our economic revival. You know that we were, really doing well up to a point, and then Omicron struck us, and then now the economic revival is slowed down. So I think we need to again get back economic revival to the pace at which it was growing. And the way we can actually, ensure this kind of safe environment to do this is through giving booster shots to people who believe that booster shots will basically allow them to come to work or carry out their daily duties.
No, but as we've seen with the US, there's no guarantee, Kiran, that Yes, go ahead, go ahead.
No, even hospitals today are seeing that their services are highly disrupted because large numbers of nurses and doctors are testing positive. And most of these people have not yet received boosters because they got caught with the Omicron virus before they received their boosters. Now, I'm not saying that the booster dose is going to prevent infections in the future, but I do believe that boosting your immunity just makes people a lot more comfortable about not falling prey to severe disease.
Sure, that's the point I was going to make. There is no guarantee that getting a booster will prevent infection or transmissibility. That's the experience, particularly even in the United States at the moment. Along with that, of course, is the growing concern that perhaps we just don't need to limit ourselves to Covishield or Covaxin. Where is Covovax, Corbevax? We have other vaccinations that could be used for booster doses. I mean, we are exporting Covovax at the moment, but it's not available in India.
No, that is a very important point you have made, Rajdeep, because there is enough data to show that when you combine Covishield with a Covovax booster, there is very good data to show that your immunity is enhanced in a very sharp way, as opposed to taking 3 doses of Covishield. So I think there is absolute merit in getting both Covovax and Corbevax to be classified as booster doses or precautionary doses. And I just think that this whole concept of heterogeneous vaccination is gaining a lot of traction globally. And we are one country that has access to a number of vaccines. So I think we should not lose that opportunity, and we should go ahead and offer these booster doses to those who are in need of it.
But precisely that's not what's happened, because at the moment the government has said that if you've taken Covishield and Covaxin in your initial doses, then you stick to the same vaccine. So the government effectively is preventing us from mixing and matching vaccines, which many countries are saying, or many researchers are saying, is the best way forward. So what you're saying is allow other vaccines to be made available as boosters so that you can increase the pie of those who can get the benefit of it, not just those over 60, not just those with comorbidities. Am I correct?
Yeah, so there are 2 parts to that answer, Rajdeep. On one hand, I don't know why they are prescribing the same vaccine dose as a booster, because there's adequate data to show that heterologous vaccinations being used as boosters is far more efficacious than using the same dose. Even in the case of mRNA vaccines, they've shown that when you combine it with other vaccines, it is very good. So I just don't understand why we are sticking to the same vaccine, especially when we have so many vaccines available to us in our country. I think a mix and match vaccination protocol must be developed. And I, for one, believe that the Covovax, Corbevax must be immediately rolled out as a booster dose for our population. Other than that, I also believe that we need to open up the booster category to people beyond the vulnerable and the frontline workers. I, for one, believe that the employees who work in manufacturing organizations are also frontline workers. They are essential workers, and they should be allowed to be boosted.
And who takes the responsibility for that? Each private employer takes the responsibility of ensuring that his or her staff gets the booster dose, and you widen the net between this 18 to 60 working age population. You're saying that it's not the government's responsibility, the private sector will take this responsibility.
Yes, I think we have taken that responsibility even in the case of vaccinations, and we will take that responsibility even in the case of booster doses.
So you're saying it's not the government which the government then can focus on those over 60, those who are most vulnerable, also vaccinate those below 18, those below 15, while private sector in particular now decides that the working age population, which is also in a way vulnerable to Omicron, they are going to, are you convinced that they will take that responsibility to give the additional booster dose?
Well, I know that a large number of organizations are certainly prepared to do that. I don't know whether every company will do that because I can only speak on behalf of the large organizations. But having said that, I think it's high time that they started privatizing booster doses in hospitals and in the hands of employers. Because I really don't think the government should really take on such a huge responsibility and decide who they will give the booster dose to and who will not get it. So I just feel that it's time that we opened up the market.
Fair point. One final question. You mentioned at the very outset that you believe that the economy which was picking up is getting hurt by the rising Omicron cases. How much of a concern is that as we enter this third wave or the third wave set to peak, it's actually going to, in a way, dramatically alter how the immediate future of 2022 is seen by those in business?
Well, already there are reports to show that we are seeing the impact of Omicron. We are seeing a slowdown in demand. We are seeing higher inflation, which is also adding to this slowing demand. And it is going to shave off at least a percentage or two to the economic GDP growth that we were forecasting. And I'm told that the Q4 forecast is a little over 3% growth.
So you're saying that this is an emergency situation. The third wave, unexpected as it is in terms of its contagiousness, requires an emergency solution, one of which is expanding the net of the booster dose.
That's what I believe so.
Okay. Kiran Mazumdar-Shaw, as always, it's a pleasure talking to you. Thank you very much for joining me here on the news today.
Thank you.